Tēnā tātou katoa.
Kia ora whānau. Paiheretia te rangi, paiheretia te whenua, paiheretia tātou katoa. Rire, hope, pai mā rire. What's up everybody? Ko Cheryl Mate ngā hope. Ko tāku tūranga ki roto I tēnei kaupapa o tātou he kaiara he Māori mo te hapori external relationships. And I'm here with some beautiful ladies today to just interview and question how much they know as nurses. No.
Kia ora everyone, I'm Karen and I'm one of the national advisors here at Whānau Āwhina Plunket.
Kia ora everyone, I'm Anne-Marie Morris and I'm a PlunketLine nurse and manager at the moment, and I have the privilege of being here today too, so thank you for having us.
Awesome.
We're going to talk a little bit about, you might have heard a lot in the media about something called RSV, and RSV is a virus, and it's a really nasty virus that we're seeing a little bit about on the radio and on the news. It's a virus that affects our little people and our children and us as adults. It starts like a cold and it affects their breathing. Yeah. So we're going to talk a little bit about it and say, like, you know, what is it? So Karen, if somebody was to talk to you and say, should I be worried about? Like, you know, what would you say?
Well, the thing is, Anne-Marie, that it's a common virus, and there's a bit of a question around the fact that we all social distanced last year. So some of our little ones haven't developed the immunity that they would have developed otherwise, and so we're seeing a bit of a surge in the number of cases. Now, it doesn't really matter whether it's RSV or not, it's the fact that RSV in little ones, particularly our very young babies, can cause some serious side effects. So that's or some consequences and conditions.
And if people are confused about, what does RSV mean? If you've got a little person or you've got friends with little people, you might have heard about bronchiolitis. And you know that our lungs, I always think of broccoli, because I think of broccoli as a vegetable, it's like a tree, you know, and you've got sort of flowery bits and then they go into sort of more of a trunk and then tinier little way. And so our lungs are full of little pathways for us to breathe, okay? And so when those littlest bits of the pathways get full of sort of fluid really, and inflamed when we've got a virus, it gets harder to breathe. And that's what our little people are dealing with.
Yeah.
You know? Yeah.
Yeah, the key difference too is the fact that their airways are small. So the smaller that your little one is, the more any inflammation in their lungs makes a difference, and it can cause a whole lot of consequences for them that as we get older and bigger, it's not so bad. Now, Cheryl's got a friend who right now has got a 2-year-old who is suffering from the consequences of RSV, and she's got some questions to ask, so we thought a good way to do it might be to use questions from a real life mama and answer them.
Yeah, hard out. So your first question is, what does the acronym RSV stand for?
Oh, that's a good question, and I should have practiced how to say it. It's called Respiratory Syncytial Virus. Now, I'm hoping I'm saying the syncytial correctly, and if I'm not, then we'll put that on the website afterwards. But yeah, that's what it means, and that's why everyone calls it RSV.
Yeah. No, the real questions now is she. So she talked about, you know, she's experienced mama with a 2-year-old, not her first baby, but what happens with mamas that have, you know, they're just having their first baby and they come across this RSV. You know, what are some kind of assuring messages that we can give to those mama?
Well,
how do you identify it even?
Yeah. The most important message for all mamas and papas, everyone out there, is to trust what you think. So if you think that your baby or little one is deteriorating, then act on that. Don't panic, but be clear about if they're having increasingly difficulty feeding, if their temperature is remaining high, if their cough seems to be worrying them more, then seek advice. Go to your GP. You can call PlunketLine. There are some danger signals that we would talk about a bit later, but really it's just managing those symptoms day to day, and can take a wee while.
Yeah.
It can take 5 days to from exposure to it to when you might see the first symptoms. So you might have to think back to who you've been in touch with. And the cough itself can last like 8 to 15 days.
True.
And that's just a standard. So we need to be aware of that, and it can seem quite a long time for a little one to be unwell.
Yeah. Hard out. Okay. And so what happens, like, you know, if they've had bronchitis before, if they've been identified that they have asthma, how do you identify the differences between the two? You know, how do we know if it's getting worse or if it's getting better, or do we wait it out, or?
Yeah, I think, do you want to answer that?
Well, I suppose from a point of view that while baby or your little person is doing all the things that you know they need to do to stay comfortable and stay hydrated, like drinking enough. So if they're feeding at the breast, if they're feeding from the bottle, having cups of water or diluted juice, if that's the only way they'll get fluid in when they're not well, you know, or making a slushy out of a drink for a toddler, you know, to get spoons of sort of a slushy liquid into them. That's a really good thing to do. So while they're drinking and able to give you pass urine or wet nappies, you know, a good sort of 4 to 6 wet nappies a day, but a little baby under 3 months, they'll be giving you maybe 6 to 8 wet nappies in a 24-hour period. So it's what is normal for them when they're well, and then look at what's changed and how much as mama or papa does that concern me. Okay, so they must drink well. If they're drinking well, that's really good, because they'll give you the wet nappies, because most of the problems come from when they get too dry.
Yeah.
You said, didn't you, your friend said today that her little one, he's thirsty in the night now because he's so busy coughing and breathing more, you know, faster than he would normally breathe. He's getting more thirsty.
Dry,
And so while he's well, you know, doing that, wanting to drink, that's a positive sign that he's well enough to want to drink.
Yeah.
I suppose the worrying signs for our little people, when our little babies get too tired to breathe regularly.
Yeah.
So a baseline is at our babies, they should breathe regularly. So they should breathe what we would say is comfortably for them. And a good thing to do is sometimes lift up their clothing and have a look at their chest and see that what they're doing is even and well paced. It might be faster than we would breathe, but that can be normal for them. So if they look comfortable in how they breathe, that's good. If they're really looking like they're working really hard to breathe, that is concerning, because you want to know that they can keep that pace. And if they've got to it'd be like trying to do push-ups and then we're saying, I'm tired now, let me stop.
Geez.
You know? So it's like, you know, if I'm working hard to breathe, and anyone that's had a respiratory problem as an adult will have an idea about how hard it is for their baby or their child.
Yeah. Babies are natural nose breathers too.
Yeah.
So it's not till they get their first cold that they actually have to breathe through their mouths. And so you might have a couple of days where they're pretty grumpy, because they do have to work on it, and they are going to need more cuddles. And Cheryl's friend was saying too that she was sitting up at night with her 2-year-old for a couple of nights, and he was just lying against her. So we have to think about that with our tiny ones, and try and keep as much as we can to the safe sleep messages. So we wouldn't put a pillow in their cot or anything like that. So we have to think about how we manage this. This is a time when you might have to call in your support crew. You know, aunties and uncles who don't have any children, friends who don't have any children, nannies, and get some help, because the whole house gets tired when you've got a child that's coughing all night. And a lot of people say, oh, but it's okay during the daytime, it gets a whole lot worse at night. And that's because everybody gets tired, and it gets dark so early these days. So the other thing I do always say to people is, try and get out during the day. Get some sun on your face, you know. If we have a decent day, and we're here in Wellington, so, you know, it's a bit dodgy, get outside, wrap everybody up. Make sure you go out in the middle of the day before it's getting cold again, And you can have some social time with other families, because we are saying try and stay away, try and keep sick people apart these days. But you could go to a playground or something like that and hang out with people in the sun. So that's something to think about. Everybody gets cabin fever, and don't be afraid to call in your support crew.
Yeah. Yeah, because that's when, you know, at night time, the air temperature might be cooler as well, and that can make the cough worse. So if possible, it's good to know that you can keep baby warm and dress them in cotton or wool, not polar fleece if possible, because that will make them sweat a bit more. And you want to be able to just know that they're comfortable to the touch, you know, and feeling them between their shoulder blades down the back of their neck is the best way to know whether they feel like what is their normal feeling of how warm they should be.
Yeah, and you can modify, if a baby's got a temperature too, it's good to modify the ambient, so the room temperature. So make sure that you haven't got your room overheated, and then take a couple of layers off the child as well. You just don't ever want them shivering, because that's our body's reaction to being too cold, and that actually puts the temperature up. And the use of Panadol, and we do have to be careful with the use of Panadol, so be careful with your dosages. If you're ever unsure, make sure you check. But regular Panadol does work on temperatures.
And if the doctor has prescribed it for one, you know, for a baby or an infant under 1, you'll know that it might help with the pain they might experience with the amount of coughing they have to do, because they'll, you know, probably get a sore chest. We all know that, you know, it's hard work coughing, and so lots of cuddles, and lots of tag teaming of other members of the family or whānau if they're around for you, because it's hard work.
Did you have any other questions, Cheryl? We had a couple that came in on the website. One was, how long do I have to keep my children home? And that's a big one, and it's a big pressure on families. So the answer is when they're well enough to go back, which sounds pretty straightforward. They need to be not coughing and sneezing anymore, because then they share the bug around again. And you want to make sure that they're well enough to go back, so that they then don't get sick again and pick up something again, because you end up in that endless round of coughing and sneezing. So yeah, it is for as long as you think. There are some simple things you can do too, like the old hand washing. Cheryl, you got a song for us.
No, I heard it somewhere, and I'm not the expert, but I heard it somewhere that you'd wash your hands to the Rā whānau Āwhina Plunket, at the back, everybody in between, the wrist.
Sing it a couple of times, and then you'll,
Absolutely.
Hey, another question. What does the weather have to do with, you know, if you're at home and your fire's lit, and then your baby's got to go to kohanga, but they're going out into the cold, and there's different temperature where they've got to go, and then they've got to come out again to come home, and they're home to another different temperature. You know, what does that have, you know, what's the play with that? Kind of, does that impact?
It can impact if a baby's a bit sensitive to it. So you might notice that they cough more when there's a change in temperature, and that's why we say try and keep your house equally warm, which is not that easy in some areas. So try and keep it equally warm. Try to avoid children getting overheated in cars. I mean, we're always taking their jackets off to put them in car seats. So it's those type of things, and also later in the day, that evening time when things seem to deteriorate a little bit. Be careful around that.
And the air can change in winter, like we're now, from any time after about 4 o'clock. The air temperature outside can get cooler, and anyone with a chest that's prone to a cough, you know, can notice that. And I know that lots of the parents that are running PlunketLine at the moment are talking about, you know, worrying about the change of their child's breathing or their baby's breathing. And so whether it's the difficulty of the breathing, whether it's faster than what you think is normal, or whether it's that it's sounding now more like it's a wheeze, and a wheeze has a certain sound to it. It's got a slightly more whistly sound to the breathing, would you say? Is that a good description?
Yeah, and it's when they're breathing out.
And when they're, so it's both when they're in and breathing out. And so those are the sort of concerning signs that people really need to think, yes, I need to see a doctor, you know, and it's okay that I'm worried, because this is not usual and it's not normal.
I guess we can't say that enough times too. You're the expert in your own child. So if you're concerned, doesn't matter whether you think that you're being a bit needy, that is okay. If you're worried, you advocate for your little one. The other thing I brought along is the back of the Well Child book. Everybody's got a Well Child book, and if you haven't, we'll put a link up where you can get it from. We'll put a link on the web, we'll get Sammy to do that for you. And it has got danger signs for little ones, and I think it's a really useful resource. You could even you could even mark that or have a photocopy of it on your fridge, because it talks about
A photo on your
when
phone.
exactly, when to call the doctor, and it talks about if children are deteriorating. So if you're seeing their temp go up and you can't get it down, if they're having increasing difficulty breathing, if their cough's getting harsher and you're not happy with it, and if they seem to be getting dehydrated, if they're not having wet nappies, not going to the toilet as often, then you would want to be just getting them checked again. Yeah, because little ones get better really quickly, but they also get sick and deteriorate quickly.
Yeah. And if you ring up to get an appointment with your general practice and you're told there's no appointments, say it's about baby or it's about your 2-year-old, they've got this cough and you want to talk to the nurse. Talk to the nurse and she'll make a plan with you about getting you in to be seen if you need an appointment. So always ask for nurse, okay?
Yeah. Hey, how contagious is it? Is it contagious?
Yeah, it is. Yeah, it
Common
is.
cold, very contagious. This is contagious.
Yeah, it can last on surfaces for quite a while.
True,
And the whole thing is hand washing, and you know how little ones love putting their hands hold your face and give you kisses. It's pretty contagious. And some people don't get sick, don't get very sick at all, and others get really sick. So yeah, pretty contagious. So all the things that we do, interestingly, all the things we do for COVID are good things to do. Continue to do them
Cough
because
to your
they're real
elbow.
basic. Teach little ones to cough in their elbow. And and keep them smoke free, and we're hoping that everybody tries as hard as they can, and social distancing, not like we're doing here. If you want them to catch up with friends and things, and you need to catch up with another mama and have a coffee or another papa, then go to the playground, get a takeaway and have it out in the sun. And that means that you don't have to worry about the bugs being spread from one to another.
Yeah. And I suppose some of the other things, where can we go for more help if we want more help, if you're worried, you can ring PlunketLine, 0800 933 922. If you're worried about an older child or an adult family member, you can ring Healthline on 0800 611 116. We'll post those numbers at the end of the chat. And you can go to our Plunket website. It's got some really good information. You can search RSV and you'll get information. You can search difficulty breathing, you can search bronchiolitis, and you'll get up the information, okay? The website's got good information, so, use it. If you're worried or you like to read something to make you feel that you've, understood it more,
Or replay this video, there's heaps of tips in there.
Yeah.
So some takeaways I took for, if you're at home and you can't get to the doctors or you can't, in the meantime, sit baby up.
Yeah.
Have them on their chest, open up their chest, keep your home
At an even temperature, maybe?
neutral, I was going to say.
Yeah.
See, I listen, you fellas.
Yeah.
If you, wash your hands, whānau.
Yeah.
Yep. And try, the other thing you can do is always feel, I guess I've said this 2 or 3 times, but it's really important. You are the advocate for your child. So for those of you out there with little babies and you might be frightened, then you can have that message loud and clear. You can even print it on your door. And my daughter has just had a new baby, and they're very clear with their visitors and with us as family. If you're not well, stay away.
Yeah.
You can FaceTime and you can Messenger and you can Skype and you can Zoom, but don't come close to us if you're not well, because we don't want our little ones getting unwell.
We're on lockdown.
Yeah. So you can put that in place and just make sure that we protect all of our our little ones.
Yeah, I know. I know we're plunketing, we're about, babies, but can adults get RSV too?
Absolutely.
Yeah.
Don't
Anyone who can get a common cold can get RSV. Yeah.
I guess the other thing is that the flu injection is available for, and it's not specifically for RSV, but we are advising that little ones who have other conditions, so little ones who've had asthma or have pre-existing conditions, can go along for their free flu vax with mum and dad or with grandparents. So check that out. Check if you meet the criteria for having that, because I think sometimes when little ones get sick and it then runs their immunity down, they're a little bit more vulnerable to RSV as well.
Yeah, and a whooping cough reminder for anyone out there who is getting new family members, new members of whānau. Our little babies are really prone to whooping cough, because they don't have immunity until they're immunised. And as adults, we can carry whooping cough without showing any signs of illness. We can be carriers. And so it's really good. If our mamas are saying, I want to protect my baby, are you immunised for whooping cough? Don't come near baby. And, if you aren't, because, until baby's been immunised, they have no immunity. Yeah. And that's incredibly distressing. The cough with that is probably even worse. Yeah.
That's probably another lead-in question. Does it affect immunocompromised babies differently?
Well, I think for our immunocompromised people, everything seems probably can be more difficult, can't it? Or more risky. And we have to, and that will be different depending on what the needs are or conditions for those people. So and usually our parents get very specialist about the knowledge about their little ones' conditions and health needs. And so as you are their expert. But wherever it's not normal and your gut is saying, this worries me, my baby or my child is working too hard to breathe, or their breathing is faster than it's ever been, and if they're under 3 months, no question, absolutely you seek medical advice straight away. Yeah.
And if you're ever in a situation where you're really worried about their breathing, of course you would call an ambulance. So if they start to look like the breathing is just too hard, they're breathing incredibly quickly, they've got a bluish tinge to their faces, of course, call an ambulance and be clear about what's going on. And the danger signs also are on the back of your well child book.
I got another question. Does bathing the whole breathing warm air in, or the vaporised air, does it help?
Well, it's interesting. Sometimes it does. For children with croup, absolutely. You would. That's one of the things that we say is that you'd want to humidify the air. Yeah. For other children, we dehumidify the air because we don't want a lot of moisture in the air. So really, it is very individual to different homes. I mean, we definitely aim for a warm, dry home in the most part. So that's our aim. Not lots of condensation. Be really clear about good curtaining and those sorts of things. And keeping your house nice at an even temp is probably the most important thing.
Where possible,
Everyone
strives for that to happen, and different parts of the country have so much, colder temperatures than even us here in Wellington. And I know how hard it is to make sure that you can provide an even temperature at home, or the fact that that it's not drafty, or not easy.
I can't think of anything.
I think probably the one thing that your friend said this morning, didn't she? She said, I'm an experienced mama because I've had a few children. But if this was my first baby, I would be so worried. Yeah. Because she gave you it. She videoed his breathing overnight, didn't she?
Yeah, she did.
To you.
She did, and what she also said too is he coughed so much during the night that he couldn't breathe for one bit there, and so he panicked, which so as the experienced mama, she knew that he'd come right, but with a first time mama, or if the baby reacts like that, just some assurance for the mama there.
And not to worry too much. I mean, you know, everyone wants to get sleep and are worried about breaking routines and things. This is a time when children just need their people close. So don't feel bad about changing some of the routines and maybe putting a nightlight in there so you can easily check them.
Yeah.
And because if you're going to be doing 2 weeks of this, you're going to be getting pretty tired. So don't feel bad about the fact that they might have food or drink that they normally have, because any fluid is probably better than none. And feel okay about doing that, because when everyone's well again, it'll all come right.
And we did talk a tip to your friend this morning. For those people who aren't using a cloth nappy, if you're using a disposal nappy, they're really good at drawing moisture away from the skin. That's what they do, you know. They're brilliant at it. But if you're worried, is my baby passing any urine, because the nappy doesn't feel much heavier, or I can't tell, pop a tissue on top of the penis or just on top of the perineal area there where baby would wee, and then you can keep checking, has the tissue paper or the bit of toilet paper, is it wet, and then you can replace it, and then you can count, so you know, yes, it's 2 hours ago that was dry, but it's wet now, that's a good sign. And then keep monitoring that way. Just some simple sort of practical tips that you can do to help you worry less or monitor the progress of what's happening.
Sweet. Okay, and we will add any resources or anything into the chat, Sammy, so that people can follow up on that afterwards. Okay.
Thank you for having us, people.
Yes.
Well, that's us.
Hopefully that's been helpful.
Yeah.
Kia ora.